Hi, I'm Dr. Joe Nyam to LoveThatFace.com. One of my great patients here is 48 hours after a deep plane face and neck lift with eyelid surgery and CO2 laser, and she has a seroma. So let's go and look at this. And a seroma is just a collection of fluid, and you can see it's like a little water balloon here, okay? And sometimes we'll use a surgical drain, and sometimes we don't. But when you have a seroma, you have to drain that. And we're going to drain it. We're going to flush it with a little bit of steroid solution and leave a little catheter drain in there for a couple days. So we'll show you how we do that. So this is a 14 gauge angiocath. It's an IV catheter on a 10 cc syringe. And we numbed a little spot here. And we're going to insert this. And we're going to aspirate this fluid from the seroma. And you can see that it's kind of blood tinged, which is not uncommon. And sometimes you have to do this for several days. That's why we're going to leave this little drain in. So we'll dispose of this and come right back. So we have removed the needle and the catheter is in place here. And you can see that it's going to passively drain, and that's what we want to happen over the next couple days so we don't have to keep draining it, and then we'll take it out. Now, I'm going to flush this with a weak solution of Kenalog and saline, and I'm just doing that for the anti-inflammatory nature because these seromas can cause a fibrotic reaction here, and the tissue gets hard and it takes a while to soften up. So I'm going to let that drain. I just want it in there for a minute to make contact, and then I'll remove that. So that's my irrigant right there. And we're going to come back here and show you how we secure this. So we've got this in place. We've got it held in place with a Tegaderm transparent Band-Aid, and so it's not going to fall out. And what we'll do is give the patient some gauze to catch that, and a little, just tape it on her chin or her neck, and we'll let that drain for a couple days, and then when we pull that out, there should be no more seroma formation. So it usually takes a couple times to drain. So that's kind of how we deal with post-facelift seromas. We've got a great patient. Thank you so much. It's going to be a wonderful result. I'm going to show you before and after picture. I'm Dr. Joe Nyam to LoveThatFace.com.